We're back here now, and tonight 22 News is working alongside Cooley Dickinson Hospital as we go pink to spread awareness about breast cancer. So joining us here in the studio tonight is Dr. Nancy McKinney. She's a medical oncologist with the Mass General Cancer Center at Cooley Dickinson Hospital. Dr. McKinney, thanks for coming on the program tonight.
Thanks so much for having me.
So I want to begin here with what are some of the most common signs and symptoms of breast cancer?
So actually, most patients who have breast cancer have no signs or symptoms, and it's identified only on screening mammogram. If someone does have signs or symptoms of breast cancer, it can be a mass in the breast or changes in the skin of the breast. Also, it can cause swelling or a lump under the arm.
And are there different types of breast cancer that a person can have?
Yes, there's actually, the more we learn about breast cancer, the more we realize that there's about as many different types of breast cancers as there are women who develop breast cancer, and our treatments are very individualized for the individual tumor and the individual patient as well. But in general, they can be divided into estrogen receptor positive tumors and estrogen receptor negative tumors, as well as several other types of divisions of tumors. And and the treatments vary somewhat depending on the specific subtype of cancer.
And what is the typical survival rate for someone who's been diagnosed with breast cancer?
So that is extremely optimistic. All comers, it's greater than 90%, and that's really been increasing over the last 50 years. And even women who have stage 3 breast cancer, stage 2, stage 3 breast cancer, well over 50% of these women will survive and not die of their breast cancer. And so we are becoming very, very good at curing patients with breast cancer.
Dr. Nancy McKinney, thanks for coming on the program here. And once again, we're going to be chatting with Dr. McKinney again on 22 News at 6.